I'm Jeremy Davis. I'm a consultant ear, nose and throat surgeon at Medway NHS Foundation Trust, and I'm going to discuss the inclusion of tonsillectomy for recurrent tonsillitis in the evidence-based interventions document. This doesn't include tonsillectomy for other reasons which may still be valid. Tonsillitis is a condition which is quite common in children, young adults and sometimes in older adults. The tonsils get infected and are painful. You sometimes see patients with other sore throats which are not tonsillitis. Treatment of most cases of tonsillitis is supportive with some painkillers and some hydration, but more severe cases may need treatment with antibiotics. Tonsillectomy surgery causes pain for up to 2 weeks afterwards, and there are also risks of bleeding and infection and some other smaller complications such as fluids going up the back of the nose. And whilst most patients recover without any problems after a couple of weeks, then it is certainly uncomfortable and is not without an element of risk. A tonsillectomy operation to remove the tonsils to treat recurrent tonsillitis is recommended less often than it used to be. We have criteria which are set out in the evidence-based interventions programme regarding the number of attacks per year or over a number of years which are required to show that there may be benefit from doing a tonsillectomy. And if somebody's had fewer attacks of tonsillitis than those set out, then usually we would not recommend tonsillectomy. I specialise in the treatment of ear, nose and throat conditions, and for me the evidence-based interventions programme guidance on tonsillectomy for recurrent tonsillitis is really important, because it means that hopefully we will only see patients referred to the ear, nose and throat clinic where we would consider offering a tonsillectomy, and that will give more time to see other patients who may have more serious conditions. I and my colleagues at ENT UK welcome the inclusion of tonsillectomy for tonsillitis in the evidence-based interventions programme, allowing us to use the scarce resources that we have most efficiently.